Amid rising fares related to the COVID-19 pandemic, the National Health Insurance Authority has accelerated the introduction of its telehealth platform in a bid to prevent the spread of the virus and to limit in-person medical interactions. So far, 11 of New Providence's 16 public clinics have introduced telehealth, according to NHIA Managing Director Graham Whitmarsh. He said the remaining clinics will be switched on in the coming days.
30,000 of the NHIA beneficiaries will have access to telehealth. Telehealth will be provided to NHIA beneficiaries free of charge. We have also turned it on for the private patients.
3 people have tested positive for COVID-19 in the Bahamas so far. However, health officials said they expect more people to test positive for the virus in the coming weeks. Prime Minister Dr. Hubert Minnis imposed an 11-day curfew and suspended operations for most businesses across the country. He said the measures, though harsh, are intended to save lives, to protect health, and to aggressively attack the spread of the virus, which has caused mass hysteria in several countries around the world. Whitmarsh said NHIA's telehealth platform should also assist with that.
First, individuals can receive routine care remotely without needing to go to a clinic. That's important when we need to maintain social distancing. It avoids them facing the risk of infection in a clinic waiting room and enables them to do it at home, which is much more convenient. Most importantly, during the time of a pandemic, it will reduce the number of patients who go to a clinic and hospital. And this is important because the clinics and the hospitals need to focus on individuals who need inpatient care.
He said NHIA will continue to roll out its platform and increase the number of clinics involved. He noted that these measures will greatly benefit those on the front lines of the outbreak.
What we've heard is that the medical staff in hospitals, as they get patients who have been unfortunate enough to be infected with COVID-19 and have to be hospitalized, we want them to be able to focus on that care rather than treating individuals that may have very mild symptoms and who the best advice is that they should quarantine themselves and monitor at home. And so we're really supporting those patients who are not in the hospital, which is going to be the vast majority of individuals that are unfortunate enough to get the infection.
Whitmarsh explained how people can take advantage of this program online.
They can access it using a smartphone and a tablet. They'll have to download an application called HEALOW, H-E-A-L-O-W. That information can be gained by calling the clinic as well. They download that app. That app allows them to set appointments and actually conduct the visit. The visit is done securely. It's done within the technical architecture of the electronic health record. They can also do it by logging in online on a computer. But what I would suggest is an individual of any one of those 16 clinics who thinks that they'd like to get care by telehealth should call that clinic and they'll get instruction on how to receive care.
Reporting for Guardian News Network, I'm Jasmine Brown.